Success in Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
And welcome. You are listening to the Financial Survival Network. It's Kerry, Lutz, and Obamacare. Well, especially after the current election, the results, total repudiation of Obamacare and the ruling Democratic Party. Well, nonetheless, Obamacare is still affecting you, your doctor, and the entire healthcare industry. So you got to know, at least for the time being, how to deal with it. That's why we've got Dr. Elaina George back with us now. You know her well, board-certified otolaryngologist, graduate of Princeton, degree in biology, and really been ahead of the wave on Obamacare and its devastating impact on healthcare. And Dr. George, we're so happy you're back with us. How are you today?
I'm fine. It's a pleasure to be back with you.
Hey, so obviously Obamacare has had an impact on your practice. How has it changed for you since the beginning of the year?
Well, it's made it very difficult to take care of patients. And unfortunately, it's not only had an effect on people who actually have the Affordable Care Act. It's on every commercial insured plan. The deductibles have gone up, the out-of-pocket costs have gone up, and like many doctors across the country, we're having people who make appointments, but when they find out that they have to pay their deductible before their co-payments kick in, and that can be anywhere from $600 to $6,500. I've seen that recently. They cancel their appointments. So people are not getting care, and I think that people need to be aware that when they say the healthcare bill is working and that the healthcare costs have come down, in the real world, it's because people can't afford to use it.
So the reality is that that people are getting less medical attention and care as a result of this thing than they were before it was passed, right?
Absolutely. This is cost sharing. It's called medical cost. I should say having the patient take on the brunt of what the medical cost is. And so there's been a shunting of the responsibility from the insurance companies to the patient. And they sold it as cheap premiums. You can be subsidized. You can just do whatever you like. But in reality, it's the opposite. It's a tax. It's denying medical care for people. And the people who need it the most are the ones that are getting the least care.
And obviously for you, it's meant that your revenues have gone down and you're effectively able to treat less of the needy people that you were in the past, right?
No question. But to even beyond the revenues, it's what I can do for people who I am able to see. We're now getting letters back from insurance companies telling us that what we would like to do for the patient if we ask for permission is, quote, not medically necessary. So they're totally circumventing our medical boards, our specialty boards, and what we're told is medical standard of care. They're just saying, we don't care what it is. We'll tell you what we're going to approve and what we won't approve. So it's a joke. I mean, we have now a Bigfoot of insurance companies as well as the government into the doctor-patient relationship. And their goal is to keep the prices cheap. It's not healthcare. It's control.
So have you thought about just switching to having your patients just pay, just go to a cash patient model?
Absolutely. As a matter of fact, I'm looking very closely into beginning a subscription model to my practice, something called direct pay, where for a small amount per month that the patient pays, it would cover everything that gets done in the office, including discounted medications and discounted labs, et cetera. So we're talking about going outside the system, and this actually exists all over the country. If people go to a website called iwantdirectcare.com, they can find doctors all over the country who are instituting a direct pay practice. And it's no longer thousands of dollars that you have to put up front. It's a fraction of what it costs to see the doctor now using your insurance. And if people keep catastrophic plans in place, they can use that for big ticket items. And there's something called medical cost sharing, which is allowed under the Affordable Care Act, where people get together, pool their resources, self-fund, and actually take care of each other's bills. That's the best way that I find to handle the situation. You end up being able to again, have a relationship with your doctor. You opt out of this transparent system where everything your doctor tells you is on a cloud, and they know exactly what your diagnosis is, what medications you're on. You have absolutely no privacy in a system like that. And when you go back to basics, where the doctor and patient rule, that stops happening.
Yeah. And so, everything that you're talking about here, we talked about months before Obamacare became the so-called law of the land. And there's really no surprises here, is there?
The only surprise is that videotape that surfaced of Professor Gruber, crowing about the fact that it's a tax and they lied to us to make us think that it was going to help us. In actuality, it was already or always designed to take money from people, to transfer wealth from the young people to the sick portion of the population. And I always thought that this was a transfer of wealth. He just admitted it. So this is not anything to do with healthcare. And the sad part about it is that it's costing everybody more money. They're getting less care, and they've actually broken the system. So now we're seeing doctors who are at the top of their profession, prime of their profession, leaving, doing something else, because they don't want to be victims in the system and work against their patient. Once you lose doctors who actually believe in the Hippocratic Oath, you're going to have a system that's exactly what they want, where it's all about cost, all about keeping the prices cheap. Once you get sick, it's about making you feel, palliation and hospice, not really helping you anymore, just taking your money. And that's not a system that any doctor worth their salt will ever be a part of.
Yeah, it's really exasperating. And now it's proof, like you were saying, that Gruber, a genius from MIT, who was the shadowy hand behind Obamacare. Now we know it was all deliberate, and he's making all these heartfelt apologies, right? And but now we know it was all done deliberately, and how they can let this go on is beyond me. I mean, look, there were a lot of problems with the prior system, and you and I could spend days talking about them. But somehow, for your average middle class working person, it somehow functioned, right? It somehow got them the service that they needed, often at a price that they could afford, sometimes not, but it worked, right?
It worked better than it's working now. I think what people need to understand is that they doubled down on the worst aspects of our healthcare delivery system. They centralized and empowered the very entities that were causing the cost to go up. Hospitals were empowered, insurance companies were empowered, the government has been empowered, and it's all now about regulations and paperwork and bureaucracy, and no longer about healthcare. I mean, they have whole panels that have been set up to decide what gets covered, what medication the insurance plans will cover, and not asking the doctor or the patient. If they ask the doctor and the patient, they would actually figure out why it doesn't work. And it's not about as one size fits all. That's what makes it expensive. When you enter a hospital now, you actually go into a system where it's algorithm driven. They vaccinate you. They do workups for various bacteria that are resistant, whether you need it or not. So all of these protocols that are put in place just cost a ton of money, but there's no thought involved. And if they worked, we wouldn't have the increasing rate of multiple drug-resistant or infections in hospitals. So it obviously doesn't work. And if you really think about it, it's been centralization of everything. The independent doctor is being pushed out of business. They want doctors to go on the payroll of various hospitals because they can control doctors when they do that. The hospitals have now gotten bigger and become systems. This is not a system that's user-friendly, and it certainly isn't friendly for people who are cost-conscious. So it's a disaster. But I think, and what I really want your listeners to know is that they don't have to do this. There are options. Direct pay is an option. Medical cost sharing, a company called Liberty Health Share, for example, where it's allowed under the system and you will not be dinged with various penalties because you actually are following the mandates of the law. But because it is not insurance, it doesn't tie you to a system that your autonomy is lost, your privacy is lost. And believe it or not, it costs a fraction. For $199 maximum, that's the most expensive policy for someone over 30. It's $500 out of pocket for the entire year. and you get covered for $1 million per occurrence per year. There are other policies that are cheaper that cover you at $125,000 per occurrence per year, but the bottom line is you're not spending $500 or $600. You're not spending $2,000 and $3,000 plus out of pocket for them to tell you no. Because it's not insurance, if it's medically covered under their system, it's paid. And the doctors don't have to play the game of doing what you need to do for the patient and begging for some insurance company to let you do what you're supposed to do. It's not working. And as long as people feel like they have no other choice, we're going to continue to have this get bigger and bigger. I think people need to know that they have a choice. And if they go to libertyoncall.com, they can actually start to explore their options. Because it should always be about choice, Terry, honestly.
Couldn't agree with you more, Dr. George. And hey, up next, want to talk about others of these choices that you have. Businesses have other choices as well on the Financial Survival Network.
FSN Radio. It's all about what's next.
Every week the show is growing. Would you like to be a part of it? Then go to clubfsn.com and help support us with $1, $2, $5, or $10 a month and get a host of premium content with newsletters dropped into your mailbox, free books, private audio clips, webinars, and much more. Then join clubfsn.com. If you want to get ahead of the trend and ensure your family's financial security before it's too late, go to clubfsn.com and sign up.
The Financial Survival Network. It's all about what's next.
Hey, in case you just tuned in, we're talking with Dr. Elaina George, well-established physician in the Atlanta area. And hey, she's fed up right now with the whole Obamacare implementation, the fact that the government and big insurance companies are telling her what she has to do, how she has to practice medicine, and it's just no way to run a healthcare system. And Dr. George, for businesses, if they self-insure, basically they're exempt from Obamacare and basically a lot of the mandates, and then they just simply get a regular insurance company that they reinsure with, and basically a lot of the requirements of Obamacare fall by the wayside. So that's one way of doing it. You mentioned Liberty Health Share. There's a lot of ways around it, but at some point this thing is going to come crashing down. We got the Supreme Court reviewing yet another case about the subsidies, because it seems like the companies that, the states that didn't create their own healthcare exchanges weren't intended to get subsidies directly under the law. And since most of the red states didn't create them, then the IRS unilaterally changed that law. Now it's going to the Supreme Court. So perhaps we might see it struck down there. But now also we're seeing the enrollments, instead of being 13 million for this year, are going to be 9 million. And that's probably exaggerated as well. I mean, we're seeing this thing, Dr. George, collapse all around us, aren't we?
We absolutely are, but we're hearing the proponents of it. It's like they're living in an alternative universe. Oh, it's great. It's working. Everybody's happy. It's like the Democrats who lost the election saying, hey, we really won. Yeah. I mean, it's kind of funny if you really think about it, except it's not, because it's about people's lives they're playing with. And that's the problem with this. And they don't care. They just want to win at all costs. Everybody be damned. And I think you're right. I think this is in the death spiral, to tell you the truth, but how long will it take to end? That's the problem. Yeah. And even though the Republicans run the election, I'm of the mindset that I don't trust anybody at this point. And I'm going to be no, you can't. And I'm going to be on my representative and let them know that I'm not happy and I want this change, and you got voted in to do a job and you need to do it. And at the very least, they could vote not to fund Obamacare. Like, while all this is going on, they should withdraw the purse strings, just pull them tight so they can't implement things. That's easy to do. Doesn't matter if the president's against it. He can't veto that. That's the whole point of the Congress. And I really question the Republicans, because they could have done this when they were in power for the last 2 years. They chose not to. But now they don't have They don't have an excuse anymore. And I think we need to hold them accountable.
I couldn't agree with you more. And, Mitch McConnell, he's been around for 20 years, never been my favorite Congress critter there. I've never trusted him, but listen to his press conference after the election, and he actually sounded like he got it, and you'd have to be an idiot not to get it, honestly, here, because there's a lot of things that Americans are fed up with that you have had it with. But first and foremost on the list is Obamacare, because now you're paying twice as much if you still have insurance, and you are literally getting half of what you used to get. So now, it's really a case of you're mad as hell and you're not going to take it anymore. And if Republicans don't want a third political party, they better do something, because they'll be finished as well.
Oh, I absolutely agree with that. No question. And that's a good thing, because they've taken us for granted on both sides forever.
Yeah.
And finally, the people, they committed fraud. That videotape, that YouTube is an absolute admission that they committed fraud. They knew what they were saying was a lie. They couched it. They made it as convoluted as they can possibly make it. Now they're laughing in our faces, and they're making us pay for the privilege of getting nothing. And this is the beginning. Every year, this is going to go up. It's already doubled. People have been, and they've done everything. It's very political. After the election, then they announced, we're going to raise rates. We're going to kick people off who had the plans that they liked. They're going to go next. Then the small businesses are going to get their rug pulled out from underneath them. And down the road, all those states who took the money from the government's kicking in now.
Medicaid,
but I think that's right, but that stops. And then it becomes the state's responsibility. And then everybody's going to have their taxes raised.
Yep.
That's the end point. Nobody sees this. They just want it. I don't know what they're thinking, but I'm looking at the long ball picture here. It's never free. Never.
Yeah, well, what they did here in Florida, Rick Scott, one of the reasons he was so unpopular in Florida, he wanted to take the Medicaid money and expand it. And the legislature saw the bait there, saw what was wrong with it, and said, no, we're not going to do that, because we're going to wind up having to put in a state income tax to pay for all of these Medicaid recipients, because once they're getting Medicaid, you can't take them off of it, right? It becomes an entitlement. So we're going to subsidize insurance for them for the 2 years that we're going to get this money. We'll put them on insurance. After that, well, the money will have to come from someplace, but that's the end of it. And, we'll just have to see what happens. But, some states took it, and they're going to regret having taken it, just like you said, because the alternative will be to go bankrupt, be paying for this stuff, for the expansion of Medicaid. But the other thing is, Dr. George, the number of doctors that will actually treat Medicaid patients is declining dramatically. So you got Medicaid expansion, but who's going to actually treat these people?
Well, I can tell you, we've already seen the writing on the wall here. We have an expansion of the responsibilities and scope of practice of nurse practitioners, physician assistants. That's who's going to pick up the slack. And foreign trained doctors. It's pretty obvious. It's already happening.
Right.
And those doctors like myself, who I'm really old school and hardcore. My Hippocratic oath is sacrosanct. I will never let anything stand in between me and my patient and practicing that. There's a growing number of doctors who believe, like I do, that we're not going to be part of the system because we can't. Ethically, morally, we just can't do it. So there's going to be a two-tier system that gets created. And the interesting thing about this is that people will find if they really take the blinders off, really start doing due diligence, it's going to be cheaper. You're going to get better care. You're going to get faster care. And you're going to be able to keep money in your pocketbook. And that's already happening with direct pay practices, with medical cost sharing. Stay out of the main systems and start doing things that are independent, because we want to make a deal with you. This is business as well as an art, as well as a science for us. So we get it. And if you cut the middleman out, you actually can actually treat people, and it's a fraction of what it costs. There's a lot of graft and bureaucracy built into the system as it stands. That's what people are paying for.
Oh, sure.
Unfortunately, doctors are the face, so we get the face of it. Like we're doing it, but we're the least of the problem.
Hey.
My rates haven't changed for 10 years.
Unbelievable. A quick question. Using nurse practitioners and physician assistants. Now, obviously, you don't want to use them in place of a doctor, but do they have a role in the system?
They have a role, but their role has been expanded, so they really are replacing the doctor. Notice now we're called providers all of a sudden. We're not doctors anymore. We're just part of a team.
That's demeaning.
Health maintenance, accountable care organization, meaningful use. These are all watch buzzwords. That means the doctor is in the background, and the foreground is the nurses and the physician assistants. We're overseers now, for the most part. And the only thing we oversee is to just sign a prescription, walk in the door. All the work is done, depending on the practice you go to, by the mid-levels, and the doctor is just there in name only, just to sign off. That's not medicine. And I think patients need to realize that and stop going to those places. You need to demand more if you expect to get more.
What is the proper role for a physician in the scheme of the healthcare system here? What should the doctor be doing?
The doctor's supposed to be the focal point. The doctor and the patient is the focal point of a properly run healthcare system. There's absolutely roles for the nurse practitioner and the physician assistant, but they're adjuncts. They follow what the doctor sets as the treatment goals. They're not the front line to do the history, do the physical, and then the doctor signs off on what they do. That means the doctor doesn't have any primary contact with the patient, and everything's filtered through these guys. That's not how it works. That's not how it used
That's
to
what
work.
I was hoping you'd say. You make the decisions. The doctor makes the decisions. They might get input and data from the nurse practitioner, from the physician assistant, but it all winds up in the doctor's lap because the doctor is the one whose license is on the line after all, right?
Absolutely. And we're talking about different types of training. It took me 10 years to complete my medical school training and my specialty training in ENT. And it takes 2 years for a physician assistant. I mean, come on, is that the same thing? No.
A little different.
And so a little different. A year of taking anatomy and knowing the inside out of a patient versus looking at a computer screen, two different things.
Sure.
Right. So we're having, and not saying that they're not important, but their job is different. It should not be.
Gotcha.
Taking on an ICU, running an ICU is not appropriate, but it gets done every day in this country. And what patients don't know is who's taking care of them. That needs to stop. And it should never be about money. It should be always about the individual patient. But because it's so unwieldy, because it's so bureaucratic, so much money is floating around in this ether of all these extenders and of the insurance companies, this is what we got. And now it's time for doctors and patients to say, we're not playing the game anymore. It doesn't work.
And let's face it, the patient really does have the power, but the power has been taken away by the government and by the system, and it really needs to stop. Now, hey, Dr. George, you got a blog. You've got valuable information, especially on those shared health services. Why don't you tell us where we can find you?
You can go to Dr. Dr. Elaina, Elaina George, like the man's name.com, and there's links to everything that I spoke about. And there's other websites that I think people need to know about, atlasmd.com, Epiphany, I think it's epiphanyhealth.com. It's in Florida. These are examples of practices that do what I just said. There's Surgery Center of Oklahoma, which has all their prices on their website. Self-Pay Patient is a book, selfpaypatient.com. So it's a wealth of resources that people can now really go out and do your due diligence, do your homework. You will be amazed that you don't have to break the bank, and you can actually start to see a doctor who really cares and really will be a partner with you.
All right, Dr. George, thanks so much. Hey, and by the way, go over to financialsurvivalnetwork.com. You'll get the link to Dr. George's site. If you want to support the show, go to clubfsn.com. That's clubfsn.com. And sign up for a free newsletter. Got that webinar coming up on November 25th, 2014 at 9 p.m. Eastern Standard Time. Link will be found on the upper left-hand side of the site. Dr. George, thanks so much for coming on. It's always appreciated.
Thank you. It's a pleasure to be with you.
FSN Radio. It's all about what's next.
Every week, the show is growing. Would you like to be a part of it? Then go to clubfsn.com and help support us with $1, $2, $5, or $10 a month and get a host of premium content with newsletters dropped into your mailbox, free books, private audio clips, webinars, and much more. Then join clubfsn.com. If you want to get ahead of the trend and ensure your family's financial security before it's too late, go to clubfsn.com and sign up.
FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.